Welcome back. We're now ready to start our first session for day 2. We'll be connecting care economy with gender equality and a sustainable future. We're very honored to have a very special speaker for today, Ms. Anita Bhatia, the Deputy Executive Director of UN Women. She brings extensive experience in the area of international development, resource mobilization, strategic partnerships, and organizational change and management. And in various positions, she has helped to advance development agendas, and also she will be talking to us about the importance of building a care economy to advance gender equality. So without further ado, let us invite Anita Bhatia to the floor.
Thank you very much. And I'd like to start by just expressing my sincerest thanks to the organizers of the conference, Professor Kee Soo-yoon, distinguished panelists and others, for the opportunity to share some reflections with you today. And in my remarks today, I'd like to address both the paid and the unpaid care work aspects of the gender equality and women's empowerment agenda. UN Women, together with feminist economists, gender equality advocates, and development partners, has long called for attention to the care economy and to the vital importance of women and girls' unpaid care and domestic work that, together with paid care services, allows families, communities, and economies to function and to thrive. And we know that even before COVID-19 hit and created greater demands on an already beleaguered care economy, that women were actually performing over 75% of the total amount of unpaid care and domestic work in the world, but largely unrecognized and unvalued. This is work that we all depend on, but it is not included in labor force surveys, it is not included in GDP figures, and as a result, the realities and the economic and social contributions of unpaid care and domestic work are absolutely invisible in data and in statistics that inform policymaking and policy interventions. Were such services to actually be valued on the basis of an hourly minimum wage, they would amount, according to some calculations, to 9% of global GDP. For example, in the context of the US, Nancy Folbray and Jo Yoon Soo have calculated there to be an upward adjustment of GDP by as much as 43% for 2010, compared to a previously found adjustment of 26% for 2004. The pandemic has exposed the vulnerability of care systems around the world and intensified attention to women's unpaid and domestic work worldwide. While men report doing more work, women actually continue to do the lion's share of the work. And this has large, significant, and consequential policy implications. Even before the crisis, we had overwhelming evidence that unpaid care and domestic work burdens constituted a large portion of the spend of women's time and constrained women's ability to participate equally in employment and in social and political life, and to earn an income commensurate with that of men. For example, we know from a cross-country study done by OECD that time devoted to unpaid care work is negatively correlated to female labor force participation. And in countries where women spend around 5 hours of their time in care work, only 50% of women were active in the labor market. Whereas in countries where women spent only 3 hours in care work, the labor force participation increased by 10%. We know that with the crisis globally and across all regions and country income groups, women have been affected disproportionately and differentially by job losses more than men. Women-dominated sectors of the global economy were disproportionately affected by pandemic-related job losses, and women, we can see, are struggling to get back to work. There is already evidence of declining female labor force participation. And we know that some of this can be attributed directly to care responsibilities, to lack of support for care, and to limited workplace flexibility, which is obliging women to leave employment and is making it very difficult for women to regain the jobs they had lost. In South Korea, COVID-19 data produced by the Center for Transnational Migration and Social Inclusion makes this very, very clear. 52% of women want to quit their jobs due to the childcare burden that they encountered during the pandemic. And in the United States, we know that more than 2.5 million women actually left the labor force compared to 1.8 million men in the first year of the crisis. Without affordable and accessible childcare and care for the elderly and sick dependents, women will simply not be able to re-enter the workforce and participate in the economy on an equal footing with men. The aftermath of the crisis has made it clearly and indisputably evident that there is a very strong policy imperative right now to rectify the acute deficits in quality, affordable, and accessible care services through policy and investment decisions that do three things. First, that recognize the existence of this burden. Second, that seek to reduce the size of this burden. And third, that seek to redistribute women's and girls' unpaid and domestic work between men and women, and between the private and the public sectors, where there has to be more attention paid to ensuring that paid care workers, in line with the central contribution they make to societies and economies, are actually paid the same for equal work. But what we know about the global response to the pandemic and what we have seen in our analysis of governments' responses to the pandemic shows that by and large, governments have sadly fallen short of these kinds of policy interventions. UN Women has been working with UNDP and has launched a COVID-19 Global Gender Response Policy Tracker. And this tracker covers over 3,000 measures across 219 countries and territories. And it looks at what is the impact of these interventions and what issues they are addressing, and more importantly, what issues they are not addressing. And what we have found is that only 11%, or 180 out of the 1,700 measures that we looked at that covered social protection issues and labor market issues, actually address anything remotely corresponding to the care economy. So overall, I think it is safe for us to say that governments need to step up and do a lot more than has been done thus far in response to the pandemic. Now, in a few countries, there is some recognition of the potential of investments in the care sector as a key policy intervention and as a key lever for economic recovery, with the potential to actually generate jobs and more productivity and to grow the pie, to build human capital and to support women's economic security. So for instance, we've seen that in the case of Canada's 2021 budget, there are historic allocations for childcare to promote job creation, to support working parents, and to provide all children with a fair start. In the US, the Biden-Harris administration in its American Rescue Plan and in the American Jobs Plan is investing in the care economy in a break from the past. And these plans actually consider spending on care work as an investment as opposed to expenditure. And they aim to invest significant sums of money in the care economy, including $39 billion in the care economy for childcare assistance to help hard-hit families and childcare providers and to cover their costs so that they can remain afloat, to help cut the costs of childcare for families by increasing the child tax credit from $2,000 per child to $3,000 per child, and by putting aside $225 billion for women in the care workforce, $25 billion on affordable childcare, $45 billion to expand summer meal programs to all children worldwide, and $400 billion for quality, affordable home or community-based elderly care. So the way forward, ladies and gentlemen, for containing the immediate fallout of the pandemic on women and to build back better or build forward better for women and girls means supporting the capacity of governments, particularly in the global South, to mount a gender-sensitive response in the face of extremely constrained fiscal space. We know that almost $11 trillion have been spent worldwide. Close to 12% of global GDP has been poured into the global fiscal response, but it has been largely concentrated in rich countries, in high-income countries. And so this issue is connected to the issue of the overall fiscal health of economies. Debt relief, the issuance of special drawing rights by the IMF, and sustained or increased levels of overseas development aid will all become increasingly necessary and really, really important in preventing major regressions in gender equality in countries that have been hard hit by the pandemic. And we know that this will continue to wreak havoc in low-income countries. And as G7 countries gather in Cornwall in June, it is essential that they make a renewed commitment to maintaining mandated levels of overseas aid, as agreed by OECD DAC, including to increasing financing for gender equality, so that there is fiscal space for these essential investments in the care economy. Rebuilding economies by investing in an affordable, quality child and elderly care services and infrastructure is absolutely essential. And there will be noticeable gains in job creation and returns in terms of tax and social security revenue, as well as longer-term payoffs in terms of women's employment, their health, their security, and in terms of children's capabilities and more equitable health and well-being outcomes overall. At the same time, the rights and rewards of paid care workers must be strengthened, particularly migrant workers, domestic workers, healthcare workers, and those providing child and elderly care and care on the front lines of the crisis. It is high time for us to stop considering these social expenditures, but rather what they actually are, which is investments in sustainable development that is predicated on gender equality and care for all, but requires significant reforms in order to realize significant returns. In 2015, when the 2030 Agenda for Sustainable Development was adopted with a target on recognizing and valuing unpaid care and domestic work through the provision of infrastructure services, through social protection and shared responsibility within the household under SDG 5, it was clear that demand for paid care work was rising. However, care work has not traditionally met the standards of decent work. This is where public sector investment in the care economy is absolutely crucial in ensuring that paid care workers are adequately paid and protected. At the same time, an estimated 2 billion people were in need of care. By 2030, this number is predicted to increase by 200 million, including 100 million older persons. The aging demographic trend, particularly in East and Southeast Asia, escalates care needs. Additionally, we know that up to almost 200 million people with disabilities will require assistance through their entire lives. 2/3 of the global care workforce in education, health, social work sectors, domestic workers are women. In occupations and sectors that are feminized and undervalued, characterized by low pay, low status, poor working conditions, insecure or non-existent contracts, little or no social and labor protection. So let me make a quick pitch here for the urgency for ratification and implementation of ILO Conventions 189, which covers domestic workers, and ILO Convention 190, which covers violence and harassment in the world of work. Doubling investment in the care economy to achieve the SDGs would create 269 million new jobs by 2030 to meet this rising demand. We need to ensure that these are quality jobs, and we need to ensure that these jobs are ones in which governments invest in skills, training, and make other investments that allow these jobs to exist and to be supported. UN Women has led the UN system in undertaking evidence-based research, developing and applying a policy guidance tool and advocacy efforts to make the case for sustained investment in care infrastructure, to not only meet an urgent need for women and their families, but also to create decent employment opportunities for women and to generate economic returns. For example, in Turkey, we have worked on expanding early childhood care and preschool enrollments because we know that this would generate at least 1 million more jobs. In South Africa, we have estimates that expanding childcare would create 1.5 million new jobs and boost women's employment by 12%. In Uruguay, UN Women, together with other UN agencies and partners, has undertaken time use surveys, and these results have supported the development of Uruguay's path-breaking national integrated care system, which covers care for children, for the elderly, and persons with disabilities. We also believe that the private sector has a really important role to play here and a vested interest in actually helping to fill the gap in access to quality and affordable childcare for their employees. Recent research undertaken by us, together with IFC, the private sector arm of the World Bank, has highlighted the business case for employer-supported childcare in the COVID-19 era. And it shows that when companies actually support childcare, punctuality is improved, absenteeism is reduced, stress is reduced, and overall innovation and productivity rises. So these investments in the care economy will also need to be accompanied by labor market reforms to eliminate gender discrimination in recruitment, retention, and promotion, to ensure equal pay for work of equal value, and to remove occupational segregation biases. Women's position in labor markets continues to reinforce old gender norms of women, primarily as caregivers, and therefore supportive policies such as paternity leave and benefits, especially non-transferable benefits, are essential to help distribute unpaid childcare more evenly between parents while combating gender stereotypes. However, we know that parental leave policies may not be easily transferable to a lot of low-income countries where labor markets are typically hugely informal and where only a small proportion of the workforce actually benefits from any kind of structured paid leave policies or paid parental leave. And so in those cases, there needs to be a concerted effort to expand access to benefits and services for informal women workers, particularly in the context of COVID-19. These flexible workplace practices in the formal sector can also help to contribute to a work-life balance that allows employees to work shorter working hours or to negotiate flexible arrangements such as working part-time, which will also keep women in the labor force. Such policies have also been successful in encouraging fathers to take on additional childcare responsibilities, and we have evidence from countries that this can actually work. The challenges for a gender equal recovery post-pandemic are before us, but I would insist that we also have the means and the tools and the political will to actually implement these changes, to effect solutions that will create a care economy where those who care and are cared for are recognized, respected, and valued. In closing, I would like to express my sincere and deep appreciation to the Ministry of Gender Equality and Family of the Republic of Korea for its generous support to UN Women. The Republic of Korea is a very long-standing partner for UN Women, a very valued partner for UN Women, and we look forward to a continued, long, and deep collaboration across different areas of work, including that of the care economy. Thank you.
Thank you, Ms. Anita Bhatia, for your strong message on why it is high time for us to consider making this social investment in sustainable development for a more gender equal economy as we move forward.